Gentleman is recognized.
I want to thank Chairman Gowdy for his leadership and for working together to craft this legislation. And I thank Chairman Meadows and Ranking Member Connolly for helping us reach the compromises that made this legislation possible. In 1988, Mr. Speaker, Congress created the Office of National Drug Control Policy. And this is the office that should be coordinating our nation's drug control efforts and leading our response to the drug crisis, which is now, by the way, killing 175 people per day. Let me repeat that. Killing 175 people per day. However, ONDCP is failing just when we need it the most. In fact, an article published this week described the office this way, and I quote, "Empty desks, squabbles, inexperienced staff," end of quote. The failure is glaring. For example, the office is required to produce a national drug control strategy by February 1st of each year. 2 February 1st have now come and 2 have gone since President Trump took office, but the Trump administration still has not come up with a solution to this most glaring and painful problem. This is simply unacceptable. Life expectancy in this nation is falling because we are failing to respond appropriately to this drug crisis. We urgently need to revitalize and strengthen ONDCP. H.R. 5925, the Crisis Act, would make changes we need and would improve our drug control efforts if it is fully funded and implemented. Fully funded and implemented. It would expand the office's authority to direct resources where they are most needed. It would strengthen data collections and analysis to help us develop the real-time monitoring we need to understand the rapidly changing dimensions of the opioid crisis. The bill incorporated several proposals I've offered to give ONDCP new authorities to coordinate critical aspects of our response to the crisis. I've often said that we must go about the business of being effective and efficient in what we do. And these are examples of things that will make ONDCP more effective and efficient in addressing this problem. For example, for the first time ever, it would create a treatment coordinator within the office responsible for coordinating efforts to expand the availability and quality of evidence-based treatment. It would also require the office to develop and promulgate model standards for treatment facilities. Right now, too many so-called treatment facilities are taking advantage of desperate families, charging them outlandish prices, bilking insurance companies, but failing to help those in need. As a matter of fact, many people are going into these places seeking to get treatment and come out worse off because they're not being properly treated. Remember what I said. We want to be effective and efficient in what we do, and we want to make sure that taxpayers' dollars are spent appropriately. I believe that if H.R. 5925 is enacted and fully implemented, it will improve our drug control efforts, and for that reason, I am supporting the measure. However, I want to be real clear about something. Even if this bill is enacted and fully implemented, the drug crisis we are facing will likely get worse. That is because this bill does not provide the resources we need to treat millions of Americans who have the disease of addiction. According to the President's own Commission on Opioids, only 10% of individuals who need treatment for substance abuse disorders are getting it. No one believes that we can fight cancer or heart disease or Alzheimer's if we don't treat people who have these diseases. The same is true here. Imagine someone going into the doctor's office and the doctor says that, well, you're the 10th person and you're lucky to get treatment, but the other 9 that came before you, they won't get any treatment. We would not stand for that. If we don't treat people who are addicted, we will not solve the drug crisis. We may pass this bill today, celebrate the passage, and say we did a great job. We may work with the Senate to send it to the President. The President might even sign it. But then next year's overdose fatality numbers will come out. They will show that deaths are continuing to rise. They will show emergency room visits increasing again. They will show the economic effects of a crisis that is already costing us $500 billion a year, continuing to grow. It doesn't have to be this way. No, it doesn't have to be this way. We don't have to just nibble at the edges or rearrange the deck chairs on the Titanic. I've introduced legislation called the CARE Act with Senator Elizabeth Warren, modeled directly on the highly successful Ryan White Act, which Congress passed with bipartisan support in 1990 to address the AIDS crisis. The CARE Act would provide $10 billion a year in stable, predictable federal funding to states, counties, and other frontline responders. The CARE Act would provide funds for research to train health professionals to diagnose and treat addiction. It would also provide $500 million per year to purchase life-saving drug naloxone at discounted prices and distribute it to first responders, public health agencies, and the public. I offered the CARE Act as an amendment to this measure considered this week. My amendment was paid for by rolling back just a portion of the tax cuts given by the Republicans, controlled Congress to the nation's largest corporations, including the drug companies that have used their tax breaks to buy back billions of dollars worth of stock rather than lower drug prices. By the way, there's something wrong with that picture. But the Republican leadership did not make my amendment in order. The House never considered it. I support H.R. 5925 in our critical efforts to ensure that we have an office that will effectively and efficiently coordinate our drug control efforts. However, what our nation truly needs is for us to show the political courage to choose to save the lives of our fellow Americans by adequately funding treatment. And with that, Mr. Speaker, I reserve the balance of my time.
The gentleman reserves